Everyone, welcome back to my YouTube channel, The Disease Decoder. Today's our topic of discussion is cystic fibrosis. What is cystic fibrosis? Cystic fibrosis is a genetic disorder that primarily affects the lungs and digestive system. It affects two systems of our bodies, lungs and digestive system. It is caused by mutations CFTR gene, cystic fibrosis transmembrane conductance regulator gene due to mutation of CFTR gene, leading to production of thick, sticky mucus. This condition significantly impacts respiratory and digestive function, and despite advancement in treatment, it remains a serious, life-shortening disease. This is cystic fibrosis. It is a genetic disorder that primarily affects our lungs and digestive systems due to mutations in CFTR gene that results in thicky, sticky mucus production. Types of cystic fibrosis. There are three types of cystic fibrosis: classic cystic fibrosis, non-classic cystic fibrosis, and cystic fibrosis related medical syndrome. Classic cystic fibrosis. This is the most common and severe form of cystic fibrosis, characterized by chronic lung infections, pancreatic insufficiency, and other complications like liver diseases. Its main symptoms include persistent cough, poor growth, frequent lung infections, and malnutrition. These are the common symptoms in patients of classic cystic fibrosis. Our next type is non-classic cystic fibrosis. This type presents milder symptoms and may not involve all organs affected by classic cystic fibrosis. It shows milder symptoms, milder lung and drug symptoms, with some patients retaining more pancreatic functions. This is non-classic cystic fibrosis. Our last type is cystic fibrosis related metabolic syndrome. This is diagnosed in infants who have an abnormal newborn screening. Abnormal newborn. What is abnormal newborn screening? I will discuss further in the video in detail. But do not meet the full criteria for cystic fibrosis. These individuals may or may not develop symptoms later in life. Okay, these are the main types of cystic fibrosis. Classic cystic fibrosis, most common type, and its symptoms: persistent cough, poor growth, frequent lung infections, and malnutrition. This is the milder type, and this CF related metabolic syndrome is diagnosed in infants. Our next section is about the risk factors. Risk factors of cystic fibrosis. As we know, cystic fibrosis is an inherited condition. So the primary risk factor is having parents who carry a mutant CFTR gene. The main contributing risk factor is genetics. Cystic fibrosis is an autosomal recessive disorder. Recessive disorder. Autosomal recessive. What is autosomal recessive disorder? It means a child must inherit two defective CFTR genes to develop the disease. Okay. So this is autosomal recessive disorder. Ethnicity. See, cystic fibrosis is most common among people of Northern Europe, though it can affect individuals of any background. Family history. A family history of cystic fibrosis increases the likelihood of being a carrier of CFTR gene mutation, as we discussed earlier. Our next section is pathophysiology of cystic fibrosis. Cystic fibrosis, I mentioned again and again, is caused by mutation of CFTR. CFTR genes functions in the body. It encodes a protein that regulates the movements of salt and water across cell membrane. Okay, I hope you understood. Cystic fibrosis is caused by mutation in the CFTR gene, which encodes a protein that regulates the movement of salt and water across cell membrane. In cystic fibrosis, defective CFTR protein leads to the production of abnormally thick and sticky mucus. As this is abnormal, this results in sticky and thick mucus. This mucus builds up in the lungs, in the pancreas, and other organs, causing a range of complications. What it does in the lungs? Thick mucus blocks the airways, leading to chronic infections, inflammation, and respiratory failure over the time. How it affects our pancreas? Mucus obstructs the ducts, preventing digestive enzymes from reaching the intestines. This can lead to salt imbalances and dehydration. Uh, and now, sweat glands. CFTR mutations affect sweat glands, leading to production of sweat with high salt content. This can lead to salt imbalance and dehydration. Dehydration and salt balance. Dehydration and salt balance. The pathophysiology of fibrosis, signs and symptoms of cystic fibrosis. Earlier discussed, cystic fibrosis affects two main systems of the body: respiratory system and digestive system. So the symptoms vary too. Respiratory symptoms include persistent cough with thick mucus, persistent cough with thick mucus, frequent lung infections including pneumonia and bronchitis, wheezing and shortness of breath, nasal polyps and sinusitis. These are respiratory symptoms of cystic fibrosis. Now let's talk about the digestive symptoms of cystic fibrosis. Digestive symptoms include poor weight gain and growth despite a good appetite. The patient has good appetite but is unable to gain normal weight. Second symptom is foul smelling greasy stools. Our third symptom is intestinal blockage, particularly in newborns. And our last symptom in digestive symptoms is severe constipation. Okay. The other symptoms related to cystic fibrosis include salty resting skin, clubbing in the fingers and toes, infertility in males. Why it causes infertility? It causes infertility due to blockage of vas deferens. Vas deferens is a reproductive organ. I hope you understood. And last, osteoporosis and diabetes in advanced stages due to poor nutrient absorption. These are the main signs and symptoms: respiratory symptoms, digestive symptoms, and other symptoms. Our next section is about the diagnosis, how we diagnose cystic fibrosis. It usually involves a combination of clinical evaluations. First, we start with newborn screening. In many countries, newborns are screened for cystic fibrosis shortly after birth through a blood test that measures immunoreactive trypsinogen levels. Okay, I RT levels. Okay. Next is sweat test, the gold standard for diagnosing cystic fibrosis. It measures the amount of chloride in the sweat. Chloride in the sweat. High chloride levels are indicative of cystic fibrosis. Our next test is genetic testing. A blood sample is analyzed to identify mutations in the CFTR gene. This can confirm the diagnosis and determine the specific mutations. Our next test is lung function tests. These tests assess the extent of lung involvement by measuring how much air the patient can exhale and how quickly. Our next test is chest X-ray and CT scan. Imaging studies help visualize the extent of lung damage and identify infections and other complications. Our last test is stool tests. These are used to assess pancreatic functions by checking for the presence of fat in the stool. These are the ways for diagnosis of cystic fibrosis. Our next and the most important section is management. How we manage cystic fibrosis. The management involves three systems: respiratory therapy and digestive therapy. Two main systems: respiratory therapy and digestive therapy. First, we discuss respiratory therapy. In respiratory therapy, we use chest physiotherapy. Regular physical therapy sessions help loosen mucus in the lungs so it can be coughed up. Chest physiotherapy. Our next technique in airway clearance techniques is positive expiratory pressure devices. These devices help keep the airway open and aid in mucus clearance. Our next technique in respiratory therapy or airway clearance technique is high frequency chest wall oscillation, also known as WEST. It's a machine. This device vibrates the chest to help clear mucus. These are the airway clearance techniques. Next is inhaled medications. We use different type of medications like bronchodilators, mucolytics, and inhaled antibiotics. Inhaled medications. First, we discuss bronchodilators. Bronchodilators like albuterol. Albuterol are used to open the airway and make breathing easier. Mucolytics. What are mucolytics? Medications that thin the mucus. As the name suggests, thin the thin the mucus and make breathing easier. Inhaled antibiotics target chronic lung infections caused by the bacteria. Lung infections. And our third management in respiratory therapy is oral and intravenous antibiotics. Oral and intravenous antibiotics are used during acute pulmonary infections. Acute pulmonary infections. We have completed our respiratory therapy. In respiratory therapy, we discussed airway clearance techniques, inhaled medications, and intravenous, oral and intravenous antibiotics. Uh, Digestive therapy. As we know, cystic fibrosis also affects our digestive system. So, in digestive therapy, First, we use pancreatic enzyme replacement therapy. Since cystic fibrosis affects the pancreas, many patients need to take enzyme like pancrelipase to help digest food and absorb nutrients. Okay, pancrelipase enzyme. Next is nutritional support. Nutritional support is done by two ways. First is high calorie diet, and second by vitamins and supplements. High calorie diet. Due to malabsorption, patients require a high calorie, high fat diet to maintain a healthy weight. Fat soluble vitamins like A, D, E, and K often deficient in cystic fibrosis patients, so these are necessary as supplements for normal life. Next is management of cystic fibrosis related diabetes. We treat it by insulin therapy. This may require for patients who develop diabetes as a result of pancreatic damage. Okay, by these three ways we manage respire digestive therapy, pancreatic enzyme replacement therapy, nutritional support, and through management of cystic fibrosis related diabetes. And this is the last section of our videos in which we talk about sportive therapies. Our first supportive therapy is oxygen therapy. Patients with advanced lung disease may require supplemental oxygen to maintain adequate oxygen levels in the blood. Next is lung transplant. For patients with end stage lung disease, a lung transplant may be the only visible option. While it does not cure cystic fibrosis, it can significantly extend the life expectancy. And our third last sportive therapy is psychological support. Due to chronic nature of the cystic fibrosis, psychological support is crucial for both patients and their families. This includes counseling, support groups, and managing the mental health aspects of living with a lifelong illness. These are the main supportive therapies we use in patients of cystic fibrosis. Let's conclude. We discussed in today's videos, we discussed cystic fibrosis. What is cystic fibrosis? It is a genetic disorder that mainly affects our lungs and digestive systems due to mutation in CFTR gene that results in thick, sticky mucus. We discussed types of cystic fibrosis, classic cystic fibrosis, non-classic cystic fibrosis, and cystic fibrosis related metabolic syndrome. Classic cystic fibrosis is the most common type with common symptoms I mentioned here. And in next section, we talked about the risk factors. Cystic fibrosis is an inherited disease and it is autosomal recessive disorder. Um then I discussed the pathophysiology, like it is due to CFTR genes. CFTR genes encodes a protein that regulates salt and water across cell membrane, and it affects other systems of the body like lungs, pancreas. In lungs, it causes thick mucus production that blocks airways and that results in respiratory failure. In pancreas, impairs digestion and nutrition absorption. And in sweat glands, production of sweat with high salt content that results in dehydration and salt imbalances. Then I discussed sign and symptoms, as cystic fibrosis affects two main systems of our body, respiratory system and digestive system. So in respiratory system, persistent cough with thick mucus, frequent lung infection, wheezing and shortness of breath, and nasal polyps and sinusitis. And digestive symptoms are poor weight gain, foul smelling, greasy stools, intestinal blockage, and severe constipation. Other symptoms are salty tasting skin, clubbing of fingers and toes, infertility in males due to blockage of vas deferens, and osteoporosis and diabetes, as we discussed diabetes in management of cystic fibrosis too. Our next section was diagnosis of cystic fibrosis. These are the ways like newborn screening, sweat test, genetic testing, lung function test, chronic X-ray and CT scan, and stool tests. If we found fat in the stool, we can say it is due to cystic fibrosis. Then we talked about the management. Uh, First, we talked about the respiratory therapy. Then we talked about the digestive therapy. In respiratory therapy, we concluded three main ways like airway clearance techniques, inhaled medications, and oral and intravenous antibiotics. Okay, and in digestive therapy, uh, we have three ways: two, pancreatic enzyme replacement therapy, nutritional support through high calorie diet and vitamins and supplements, and management of cystic fibrosis related diabetes through insulin therapy. And at the last, we talked about the supportive therapies like oxygen therapy, lung transplant, and psychological support. This is all about the cystic fibrosis. I hope you enjoyed the video. If you enjoyed the video, don't forget to like the video and share it with your friends so that they can excel in clinical diagnosis too. Thank you.